Okay. So very good afternoon, ladies and gentlemen, friends and well-wishers. On behalf of Herbal India, I, Rakhi Bakshi, and my team, welcome you all to this very special series right now that we are doing on knowledge information sharing, in which, of course, we are taking up all kinds of experts and their voices, right? From we've talked to scientists, we've talked to virologists, we've talked to senior bureaucrats, authorities, and of course, we've been talking to a lot of medical experts. But right now, the esteemed speaker with us will be talking about the prevention of tobacco in our lives, because 31st May is a no tobacco day world over, and it is only better to also understand that what are the different diseases in front of us and how use of tobacco actually is impacting our lives and creating more danger. So to talk about that, we have a very esteemed speaker, Dr. Dheeraj Kumar with us. He's associate professor at AIMS, of course, an oral cancer specialist that he is. He's going to share his insights. We also have our partners, Policy Center General Lab, who always support us in our endeavors to talk about important and meaningful issues. So welcome, Dr. Dheeraj Kumar, and let's
Thank you, ma'am.
begin. Uh, Welcome to the show, sir.
Thank you, ma'am.
let's
Thank
actually
you.
begin let's actually begin with the pandemic which is in front of us, and whenever we talk to an expert like you right now,
Yeah.
let's see the relation and the interference of the two. So for example, though you're an oral cancer specialist, how do we
Yes.
see the correlation between COVID-19 and this?
Like relationship when we are talking with the COVID and the cancer thing is that cancer care is something which we are facing in day to day. From the last so many years, we are seeing cancer care, which is going enormously in our center also. So many patients come daily, they're getting care and all. Due to this COVID, we are saying we can shift to teleconsultation, we can defer the treatment. But for the cancer patient, the mortality rates are so much. So even in the chances of this COVID restrictions also, still we are getting cancer patients to get their primary care, which are more critical for their life, for their well-being. So they are still getting care in this COVID time also, will all the precautions has to be put, so that in spite of getting a severe reaction of a COVID, they have a more severe reaction of their cancer region, which is going to be with them. So they are getting treatment care that is mandatory for them.
Okay, one of the questions that, in fact, when I was talking to people and we were trying to do this show, were asking whether what is it about vaccination and those who have cancer. Can they get vaccinated? What is the whole situation?
Like initially, when the vaccination has been rolled out in the third phase for the healthy individuals, that time they are having restrictions for the somebody special group patients which are having some comorbidity conditions. That time it was restricted to them. Then slowly, once the data comes to us, that the vaccine doesn't have any adverse effect in a normal individual of a certain age group also, with certain conditions also. So the vaccine has been rolled out for all these needy patients, those required more prevention in this hard time. So now it is obviously has been open for all the needy patients. In spite they doesn't have a COVID history, vaccination can be done for all the individual, either cancer or having some comorbid conditions.
Okay, now as far as I was trying to understand and do some research, is there an, I mean, age and factor? I mean, let's look at patterns. So let's look at observations and regarding oral cancer.
Yeah.
So different things. For example, beginning with age, is that a factor?
Yeah, it is a age is definitely a factor. Like we have certain categories of oral cancers. Something is more common in juvenile patients when we are talking about young age cancers. Something are more common in older age. Something is more common in middle age. Some are sex specific also. Male have more, females have less, and certain occupation is also there. And the topic of our interest, tobacco, that mostly is the most culminating factor for the middle age or the older age individual, because young age mein the exposure is less. When we see the scenario for country, it is there in young age also with some people, but it is more, tobacco is more related in middle age. But when we talk about certain types of cancer, oral cancers, they may be in juvenile age, young age also. They doesn't have any origin of any etiological agent like tobacco or something. They may be just like idiopathic or something, genetics or some other factors which may going to be enhance the action in younger age also.
Okay, another thing is as far as gender patterns are concerned, it is being said that it's more in men than women. In fact, six
Yeah.
and one is the ratio. Also, because and you would throw more light on it, is that because men are more exposed to situations like that, or whether they are more used to smoking or use of tobacco. Would
Yeah,
you?
tobacco related uses. That is the answer you have given already. As the mans are like this population is more exposed to the products basically, which are more prone to causing cancer, oral cancer basically, compared to females. Female do have this in our rural part. They still have the BD smoking and other habits of tobacco is still there. So there you will get these type of patients also come to our OPD services for post-cancer treatment after resection or some rehabilitation. We do see female patients also. But when we talk about the ratio wise, major chunk is male population compared to the female population.
Also, is it true that there are more fatalities also because we've discovered the whole disease and trying to understand it? Little observations have come now, maybe more and more, that we are seeing more deaths due to oral cancer, or are we handling it?
We are handling. The thing is that one thing is like for a general individual, as I am a treating doctor, I know the problem which a oral cancer patient feels. And if somebody have a family patient which a oral cancer, they know the problems. Their problems are something not very much general because once a oral cancer happens, it is something related to the physical limitation to the psychological limitation for the patient. Fatality usually happen if it widespread in the oral cavity or other part of the body also. But if it is localized to the oral region, the management usually give a removal of the cancer from the patient body. But the resultant person, which after that resection or of the removal of that part remains, they have certain limitation of the well-being. They are not very much pleasing. Their disfigurement occur of the face. They have so much of comorbid condition associated with swallowing. Any like main function of oral cavity got compromised with them. Their speech get compromised. They can't swallow properly. And then in certain aggressive cancers, we have to go for radiation therapy. Radiation therapy do remove the cancer cells, but it has a long term effect on the body normal cells also. That is again a point of concern for the individual. So do fatality occurs, but major concern is with the after the care, after the cancer therapy, the consequences of the cancer therapy to the patient. That when we you come across a case, then you can make out what all problem they are having in a day-to-day life, in a psychological pattern, in their work front, everything get affected with that.
Okay, in India, and I always ask this question, especially to doctors, is that, so we have to also look at the whole diversity of our country and the region and the culture and socio-economic conditions. So, would you see any such observation there that in terms of urban area, rural, semi-urban areas, is there any prevalence more in some areas than others?
Yeah, yeah. This thing we are seeing is as a North Indian center we are working here. We see more of the patient coming from the rural belt of Uttar Pradesh, Bihar to our centers with the cancer diagnosis and all. Because maximum time their diagnosis got delayed. Initial lesion doesn't get diagnosed. That small lesion developed into a huge bulby mass. Still they doesn't have sometime a care, primary care to get it diagnosed. And then once they reach to a tertiary center, that is on an advanced stage where the most of the time treatment involved resection or that cutting of that part of the tissue which is overgrown in that area. So this is the problem that it is more prevalent we can say in a rural part because health facilities are not there, initial diagnosis facilities is not there. So most of the time patients think it is like a normal ulcer or some or normal lesion, they just foresee it and the habit which is causing it still get continues. So the deterioration effect it happens person to person. In some persons it may progress very fastly. Like when you can talk in terms of days, it will progress in days. In some person, it may take years, in months. So it depends on the pattern of the body cell, how the mutation has occurring place, and how the cells are going to behave in the cancer pattern.
Okay, another thing is how does a normal person detect actually the symptoms? Also, because somebody would say that there are other diseases that people generally feel it's very visible, but
Yeah.
this one maybe these are areas that are more untouched. To understand what becomes critical, is important. What would you say about that?
Like for symptoms wise, when we're talking for a oral cancer patient, like first symptoms, like if we have a unhealed ulcer in the oral cavity, a ulcer which maybe due to some sharp tooth in the mouth, or maybe due to some prosthesis, some denture patient is wearing with that, it has been done, or where the patient, sometimes patients are using tobacco products and they're keeping inside their vestibules. On that area, if they find some white discoloration, that all are the initial signs that we say the initial sign where the what we say a virus has virus, but we are saying not a virus, but the cancer thing has mutated over normal cells. They make our normal cell to behave in a aberrant pattern. So they start dividing of themselves. In spite of that area is not for them to divide there, because once the insult which is causing that area to be more damaged. So ulcer is there, some white patch is there. That is the initial part of oral cancer beginning. When we are talking about somebody who is more like the population which is more prevalent for this thing, who have a habit, who have a past history, or who is using that thing intermittently. So they have to keep them in check. Better to quit the products. If they found anything happening in their mouth, they have to get as early as possible the initial diagnosis. So if the cancer, please.
Coming back to the use of tobacco, in fact, prevention of for the use of tobacco, I would say, what would you say that what all should be done? We are talking about how mass media, of course, there are now legislations coming in for prevention of
Yeah,
the use of tobacco.
definitely. Like
Authorities, social workers, NGOs, advertisements, everyone is at it. What else can be done, really? Somebody would say tax should be higher, things like that, all kinds of methods. But what would you say would really, really go a long way in preventing the use of tobacco?
the thing is that when we all say the products has to be banned, that all the things is already going on. The products are still there in the market, people are using it. The mass awareness is the most important thing. Plus, there should be awareness at every level regarding this tobacco products consequences. Because as I'm talking to you, I'm saying you must have seen the OPD, the cases of oral cancer, or you must have somebody in a family will experience that thing. Like if somebody hypertension, diabetes, everyone knows how they appears, how the patients, cardiac patients are there. Oral cancer is something you will see the patients when you have a direct contact with them, or sometimes photos you will think like that. But the thing is that awareness is the most important point. Either it should be at a primary level, or maybe a school level, or it may be at a college level, or at an office level. Every point where the patients are where the person is getting in contact, the awareness should be there so that they should be properly aware about the consequences. Like they are not somebody a superhuman, they will not be affected by the product. So this thing is more important, that they should be aware about the product damage that is going to cause them. So if that type sensitization occur in our population, this is going to have a lasting effect on the stoppage of this product, and certainly we can make this cancer level down.
Okay, one of the things that I think patients should do is they can also self-examine, maybe before going to hospital. But how easy or tough it is to do that? I mean, what can they do?
Like self-examination, as I earlier told, as we have a white patch in the mouth where the somebody is having smoking, tongue discoloration is there, gums discoloration is there, like bleeding of gums, loosening of teeth. So there are certain advanced features. When we talk about okay, loosening of teeth are there, teeth are getting loosened up, gums are bleeding, gums are swollen up, or when we see white patches on the cheek, on the lips. So these are the initial diagnosis that patient can see if they have some oral issue. So for that thing, we can usually we says in a urban setup every 6 monthly have a dental visit. I should have go for a oral examination, oral checkup for normal oral checkup. So if somebody in a more vulnerable population they have having a habit or a history of a habit of a betel or chewing or tobacco product usage, they should restrict this oral checkup to 3 to 4 months. They should get a oral examination every 3 to 4 months. In that, if any chance of any lesion, anything is growing there, they can get it initial diagnosis, initial management can be initiated as early as possible.
Okay, another thing is it also related to the kind of lifestyle we have, the kind of food we are eating, to the kind of health structure that we have? Also, is it about the kind of regions, temperature wise, that we are in?
When temperature wise, when we are talking that type of cancer is skin surface cancer that we are talking, that is mostly related to the rays of the sunlight, where the more of the tropic region, the basal cell carcinomas are there. But when we talk about an oral cancer, they're more specifically tobacco products related. So all the thing come down to the patient's habit only. So majority of the cases which we see oral cancers are related to the habit basically. The other oral cancer group is there that is not related to the habit, that are genetic sometimes, that there may be a benign or a malignant nature. There may be some aberrant mutation inside the body. The gene system has changed suddenly. That may be due to genetic origin or idiopathic also. We don't know about that thing. As specific diets and all, they are going to happen for the proper gums health and the oral health of the patient, not related to the cancer. We can't predispose some diet to the oral cancer development basically.
Okay, and some of the simple techniques that people should adopt, people like us, normal citizens, what would you advise? For example, we are always told that, brush your teeth twice, or how to keep your mouth clean and things like that. What would you say? Those are the tips that people should follow.
When we talk about what are the tips for keeping a good oral health is something brush, floss, and rinse. These three things are very important. Brush means 2 times brush your teeth, 2 times brushing your teeth every time, like in the morning, in the night. You should floss your teeth. Floss is a normal thread. With that, you can floss your teeth where the food is usually getting stuck. As the age advance, we get food stuck inside our teeth area also. So flossing is also mandatory in that part. And plus rinsing. After every meal, we should rinse. Rinsing is going to clear over all the debris which were superficially lying on the tooth structure, that should be rinsed. So these three habits plus a regular checkup with the uh, their dentist, that will going to help them out to keep their oral cavity healthy. When we are talking about kids, when we're talking about kids, so in that area and kids and all, we have to be more careful about their food servings. So we should make it sure that whenever they're taking sweets, that let them take their sweets, but the frequency of the sweets should be slow, so that oral cavity should have a sufficient time to neutralize the acid which is produced by the sweet consumption. So frequency of the intake should be less for even children's also, for even males, even for adults also. So main thing will be again brush, floss and rinse, and keeping the oral check always. If any symptoms occur, get it examined.
We're talking about the third wave right now. We're also talking about children's health. But as far as this kind of cancer is concerned and COVID is concerned, uh, what would you say about the children and their health also?
Children, like as so much of our fraternity who is more treating with the child care and all, they come up with the guideline. They're saying there is a very less probability because of the data. It is all media. This is all rumors are there. Most of the time we will get more childs will be infected in the third wave and also COVID and all. But as the medical fraternity, as that pattern, as the trend is saying, that is not supposed to be going to be happen. Child have other immunity that is going to help them out. And the main thing is that as early as the vaccination, maybe in coming 4 5 months, it will come for the children, so that they will also be vaccinated, and they are also going to be less affected with the COVID part. In oral cancer pattern, as tobacco cessation is not related to them, because most of our younger childs are not getting exposed to these products, and so much of bans are there basically. So if some idiopathic type of growth or cancer is there in their mouth, that should be again promptly treated at certain centers where that care has been provided, so that early management for them can be initiated.
Earlier you talked about the incidences, especially in rural areas. So, would you say that more education, more awareness, more understanding would lead to better hygiene and better handling or dealing of the cases? Would you say that?
Yeah, ma'am. Like better dealing, like what I'm saying now, when we're talking in term of rural area, we need a good primary setup should be there, so that one contact, nobody has to think of always a tertiary center for a primary care. If they have a primary setup nearby to them, approachable to them, like when we talk about somebody, ASHA workers are also there, those are coming in their rural areas. If these people are more trained, training of trainers, like what we usually do workshops in our institute, when they are trained, they can disseminate the knowledge to the rural part, to the major chunk of the population. So they will be get educated at the primary level, where the things has to be given to them in their own language, and their own people can treat them and tell them what is wrong, what is correct, basically. So that if the special care is there, then only they should rush to the tertiary centers where the major care can be provided. So they should know this part of the severity of all the diseases. I will say when the what we say, the public and uh, government associations start here, when the we go to the public and then we try to educate them as early as possible.
Since sometimes it all becomes very visible in terms of how the cancer patients would look, in terms of mouth cancer, we've seen especially. But what would you say with advanced technology? And in fact, right now in pandemic, we are talking a lot about technology playing a big role in the medical field. What would you say that how, as a study observation, we are advancing medically also, or trying to understand and tackle the disease better?
Like cancer in as such, if somebody has diagnosed with cancer, after the cancer treatment, when we talk about jaw cancers, oral cancers, after the cancer treatment, some part of the jaw usually get removed to treat the cancer, to remove the cancer part. Then that removed part of the jaw, majorly in older part, that type reconstructions are not possible to rehabilitate to the normal life. Now at the advancement of 3D planning, 3D printing, 3D design, dental implants, so many 3D planning, computer design things are there. Technology has overcome now, so that even whichever missing part of the tooth can be designed digitally and can be rehabilitated for the patient, so that make them as the physical appearance of the patient and the function can be restored as it was earlier, all almost nearby to earlier, so that he can come back to society with more confidence and more energy and or more health, good health also. So technology has good taken place in rehabilitation of these cancer patients also. At the treatment plan term also, radiation therapies are also there. they can selectively radiate the part of the tissue which is affected in spite of causing more damage. More focused delivery of the radiations are also there, so that the only the affected part can be irradiated for the cure of the cancer, so that the other areas can be prevented.
This is a popular question coming because some of the young women are part of our team. Is that, sometimes it looks very cool and fashionable, and that's why sometimes young girls either smoke or use tobacco products. What should they be doing to understand much better that how critical it is to look at their own body, especially in this case when they're talking about oral care?
When we are talking about somebody who is smoking or somebody having a history of use of smoke and other tobacco products, so like it is going to have a long implication on their overall health system. When we start about oral health is going to be affected. It can be started from oral cancer. Maybe if we are talking in out of 10, one is getting, or maybe 100 met 6 7 is getting, 10 are getting, the other may have other deleterious effect on the oral cavity. Their tooth may get affected, their gums may get affected, they may lose their tooth early, they may have some other medical health problem related to hypertension, diabetes also, cardiovascular disease also related to tobacco products. So there is a cascade of change that is supposed to be happening. Initial age may we usually oversee that all things, but whatever, because these are going to harm your body, we are not going to be spared from that. The thing is that we are not going to spare from that. So we should make focus on this thing. Whatever we are taking, it is harmful to our body. In certain time, it is going to harm us or maybe the adjacent people which are attached to us also. So we have to take care of this thing, so that this all these things should be avoided.
Okay, any message that you'd like to give to all those people who are going to watch the session today? And I'm very thankful, first of all, to all the insights that you've shared here, but
Yeah.
also that, world over, we're talking about saying, taking pledge, actually appealing all of the people to say, don't use tobacco, as to what strong message it should be to really prevent them from using it.
Like I just want to say this thing, ma'am. We should not use these types of products. Basically, we first of all we should love our body. When we are loving our body, we are caring for it. So whatever thing just for a pleasure we are taking, but it is not going to provide any benefit to us, that all things should be avoided. So we should care ourselves by avoiding these all products from our body, so that no harmful effect should be given to us, so that we have a good healthy life, so that we can progress in a more futuristic way.
Okay. Thank you so much for your time and all these question and answer session, which you I think have tackled very patiently and very nicely. Thank you so much for all the insights. I'm sure people who are watching and who will be watching will really benefit a lot from this, and not only benefit, but actually work on these things that, Doctor, you have shared here.
Yes,
Take
ma'am.
care of yourself, take care of your own things at home also before going to the hospital, because I'm sure hospital are treating a whole lot of patients and they're
Yeah.
very burdened. So thank you so much for speaking to us on Herbal India team, and we wish you all the best.
Thank you so much.